Well, great. We are good to go. Thanks for your patience. My name is Caitlin Brotherton. I'm a board member here at NAMI Coastal Virginia.
And I'm Kirsten Andino, also a board member.
And if you're not familiar with NAMI Coastal Virginia, it's the largest national grassroots mental health organization. Coastal Virginia, we're serving Virginia Beach, Chesapeake, Norfolk, Portsmouth, and the Eastern Shore.
Yeah, and I'm going to introduce our speaker, Traci Hunter-Leslie. So Traci has been in the mental health field for over 30 years. She is a licensed clinical social worker, and her training is in eye movement desensitization reprocessing, or EMDR, internal family systems therapy, or IFS, and ketamine-assisted psychotherapy. And these have been beneficial in assisting clients in managing symptoms related to PTSD, ADHD, depression, anxiety, substance abuse, sexual abuse, and attachment disorders. She is an excellent public speaker and has given presentations across the country about trauma, addictions, parenting, and family systems. And she's currently solo private practice in Virginia Beach here locally. And her specialties include individual, couples, and family therapy. And she believes in a person's desire and inherent capacity to grow and change. So I'm going to hand it over to Traci to do our presentation before we get into some Q&A.
Okay, so would you guys
We'll
just
just-
switch
yeah.
the slides when she tells?
Yep.
Yes.
And then
Turn us off.
I don't think we should unmute that because you're speaking.
Hello, everyone. Thank you, NAMI, for inviting me, Susanna. And I apologize for the technology problems that we've had. So I'm going to go ahead and get started. We're going to talk about healing after trauma. I've been in this field for over 30 years, been licensed for 30 and started as a mental health worker. So it's been since 1987. So I've done a lot of work with individuals, couples, families, and as my skills, I learned neurofeedback back in 2009 and then EMDR in 2016. And so what we're going to talk about tonight is EMDR, which is a technique used for treating trauma, and we're also going to talk about internal family systems. And internal family systems is newer. It is came out probably about 20 years ago. And anybody here, have you guys heard of internal family systems? Oh, you have? Okay. Okay. You had, okay. So go ahead. So when we talk about trauma, we talk about next. We're going to talk about first definition. Would anyone here, I know most of the people are online, but anyone here like to share what they know definition of trauma is? Take a guess.
I can see the slides.
Yeah. Anybody?
I feel like it's just,
Yeah.
like in my experience, it would just be something that like stays with you, and I saw
Uh-huh.
your body keeps the score. So for me, like a big part of that is like the physical side of it, not just the mental side of it.
Correct. Absolutely. So trauma is an event or experience that that happens to us, and it affects our mental, emotional, physical, what you talked about. And it is stored in the body. What was just mentioned is a really good book about storing in the body from Basil van der Kolk. And this talks about a lot of the treatment, and it gives you information on how trauma is stored in the body. So we are going to talk today about a little bit about the brain, but mostly about treatment. Okay, trauma affects how we think, how we feel, and how we behave. The goal of trauma, what happens with trauma when we experience a life-threatening event is our brain shuts down. It moves into fight, flight, or freeze. And it does not allow the event to be processed. So we store the event in our brain and in our bodies. So what therapy does is help the person make sense, process and make sense out of the trauma. How did this happen? Why did this happen? How to get it from an unstuck place to a place where we can understand it, understand what our triggers are. trauma therapy is used to decrease symptoms and promote an overall well-being. Okay, trauma in the brain. When we talk about the brain, it actually changes the structure of the brain when we experience a traumatic event. They've done lots of studies, lots of brain scans, and they can actually see the changes in the brain that happens due to trauma when the brain shuts down. And repeated trauma even affects the brain even more. So what we're going to talk about next is EMDR or inside out. So when we talk about the brain, I love the brain. I try to keep it really simple. And when I saw Inside Out 2 back in 2006, I think the first one that came out, it gave everyone a great visual picture of what happens during a stress response or a trauma response. So who has seen the movie Inside Out? Yeah, yeah. Okay, so basically what it does is, and I have the little figurines. The movie talks about when the host, her name was Riley, and when she experienced stress, which was moving to a different state, is the feeling of sadness started coming up for her. And she had only experienced joy since birth. She had a very happy childhood. She had a lot of support from her family, a lot of peer support.
I'm
Uh-huh.
sorry.
Sure.
See, they can see it. Can you change the view of the PowerPoint? Or do we need to end it and start again? I need to get to presenter view because it's staying. They can see.
Okay. Like that. Did that work?
Let me see. Oh, I should have brought my.
Oh, they were seeing presenter.
Yes, that worked.
Sorry, guys. Thanks again.
Hello. So we have joy, and that was the experience, the feeling that we're born with, the way our brain is developed. We are born with love and fear, and then the brain develops from the back of the brain to the front. So when she experienced a stress response, which was a move, there's some grief and sadness that came up, and Joy did not want to have any other feelings. So as the movie goes on, they go down a healing journey together. And what happens is anger and fear come up. And anger and fear do not know how to manage the relationships or any feelings because Joy had the control of the brain. So the host, Riley, acts out, is mad, is angry until she is able to internalize the sadness and understand that it's okay to have other feelings other than joy. So it's about merging those feelings. So the Inside Out 2 that came out, I think a year ago, the movie introduced the feeling of anxiety. There's a lot of other feelings that were introduced, but today we're just going to talk about anxiety. So when anxiety came out with Riley, she went into puberty, and anxiety came out as a way to protect her from the feelings of insecurity because she was learning how to meet other peers, older peers. She wanted to fit in. She wanted to do what other people. She didn't want people to think she was different or something was wrong with her. And as she increased her anxiety and her thoughts, she ended up having a panic attack. And when she had the panic attack, she realized that it was okay to feel some of the other feelings. She gets out of the panic attack and they all merge and accept, and they accept the other roles, accept anxiety as part of the feelings that they all experience. So this leads us to internal family systems, because actually Dick Schwartz, the founder of Internal Family Systems, he was a consultant on Inside Out 2. So he was the one that helped the characters understand how anxiety and protector parts protect the host. A lot of things that was said in Inside Out 2 was, "I'm sorry, Riley, I was just trying to protect you." So what Dick Schwartz has come up with about 20 years ago is that we all have parts. It's based on a structure within ourselves that happen to protect our internal wounds. And that happens usually with trauma. These roles have different parts. He has established them as a manager part, and we'll go more into manager, a firefighter part, and exiles. And the exiles are the wounds. This next picture gives you an idea of how he structured the roles that we all have inside. Is the managers are the part that is a caretaker, type A personality. They're the ones that are critical. They're the ones that try to control situations and environments so they don't have to feel the internal wounds of childhood. Then what happens with the managers, if feeling starts coming up, the role of firefighters come in. And firefighters are the ones that want to put out the fire, so to speak. So they're reactive, they're compulsive, they're usually substance abuse, compulsive overeating, compulsive gambling, the behavioral part of substance abuse, self-harm. All these are a way to manage the feelings also when the manager cannot stay calm and keep things in control. So the exiles are the parts underneath, and there's actually a great visual with a book that is called We All Have Parts. And what I really like about this book is it has pictures. So the beginning of this book talks about a checklist for trauma, and it talks about all the different roles. But I actually like this picture. Let me move this. So you have the managers up here, caretakers, type A personalities, the firefighters, which are the compulsive behaviors, and then the exiles down here. So a lot of times what the managers are is they don't want people to really see what's going on inside of them. So they work really hard not to show that. And the part right here that he talks about is called the self. The self is like joy, the person that we came in this world to be, that gets covered up with trauma and family of origin and stressors growing up. So the self is in the middle, and he talks about the 8 C's. He talks about calm, curious, creative, connectedness, compassion, confidence, courageous. And if we think of those characteristics, that's the emotional well-being that we all want to get to. So how we do that is, the next one is we go into processing. And moving into EMDR, what IFS does, it gives a kind of a role for the therapist to know what are the defense mechanisms, what are going to stop the healing process. So when a therapist plays out these roles and have the person identify what are my manager parts, what are my firefighter parts, and what are the wounds underneath. So that'll give the therapist information on what our cognitive distortions are, or what a negative thinking is, which is usually our manager part. So EMDR is the technique that gets us unstuck from negative thoughts and patterns that were developed as a result of the trauma. So what happens with trauma is it gets stuck in the brain and it can't process to make sense out of it. So what EMDR does is it's a bilateral technique to go from one side of the brain to the other side of the brain. And how they do that is through a couple different ways. Originally, it started in 1980 by Francine Shapiro, and she started with, and this is the most familiar technique of bilateral, is using eyes. And so that is the original bilateral, going from the right side of the brain to the left, and the head stands still and the eyes follow. Since then, there's been a lot of technology that has come out, and we now have other ways to go bilateral stimulation, which is the light bar. See if I can do this. And then these hand pulsators that buzz. Do you want to hold them? See if I got it? And let me see if I can get it. They alternate. So it's all about bilateral, going from the right side of the brain to the left side of the brain. So in the light tube is a light that goes from the right side, from the right side to the left, which I don't know how. Okay. Now we're gonna turn this one on. And what's cool about the new technology is you can pick different colors according to, what's soothing and what's easy for the person who wants to use a light bulb. So you can change different colors. You can you can do the speed, you can do the width of, thank you. You can do the width of the light. So this you would follow from right side to left side. Okay. And then a couple other techniques is tapping. And a lot of times now that therapists are doing virtual, butterfly tapping. Okay, so those are the different ways that the eye movement and the bilateral stimulation. The D of EMDR is desensitization. And the goal of desensitization is to desensitize the emotional reaction of the trauma. So when somebody gets triggered and they have emotional dysregulation or reaction, okay, the sensitivity goes way up. And so what the goal of EMDR is to use the bilateral to decrease the emotional reaction to the trauma. Okay, and reprocessing. This is a phase that allows the brain and the person to have adaptive coping skills as opposed to maladaptive coping skills. The process of the reprocessing it goes through 8 phases, and it uses 3 different things. It uses a negative thought, so the client will come up with a negative thought that is attached to the memory, so an image, and then where is it stored in the body? And this is what what Vanderkolk talks about in Body Keeps the Score. So, for example, I feel the feelings of anger and hurt in my chest, or I feel it in my stomach, or I feel it in my throat. So you hold that feeling with the image of the trauma, and then you use the bilateral all at the same time. And how that desensitizes is that it allows the person to make sense. Eventually, they'll come to a place where the positive cognition will be the predominantly feeling and thought when you bring up the traumatic event. So it moves you from, like, for example, a negative cognition or thought, maybe, I am not safe. I am safe. So the bilateral stimulation and the putting the emotion with the image and getting that from I'm not safe to I am safe. And it's like an experience that people describe is like putting the memory or the experience like at a distance. So it's more like a movie, and it's not like right up like a flashback right up in your face. So that's okay. So the treatment plan is between the therapist and the client, and they come up with the negative thoughts, the images. The length of treatment, it depends on the history of trauma, the number of traumatic events. There's how we kind of look at trauma is big T's and little T's. The big T is like a major catastrophe. Or a single event that's very big. And then the little T's are repetitive. It could be growing up with a critical parent. It could be bullying multiple times. It could be a sibling issue. And those are what we call little T's. So, and those are collective also. So as you work on the treatment plan, you identify those with the therapist, and then you do the sessions, and the length of treatment depends on how quick the brain processes information. And one of the things that we talk about in EMDR too, if you start with, I look at my hand, if you start with a major traumatic event, you may get we call these finger layers that may come up as you're processing the major event. You and the therapist will determine, do you want to go down that path that triggered another memory, or do you want to stay with the core memory? Or a lot of times if you work on the core memory, these other little memories will get desensitized. So healing, I guess we're in good time. Healing is a journey, and it's not linear. And all the years that I've worked with people, they want to know, I've had somebody say, I had a setback, or I feel like I went forward and then I went back. What I say to people is it's not linear and forward is forward. The body processes information. I also use the visuals as peeling the onion. Okay, so you peel a layer off and then you function and you have adaptive coping skills. And then something comes up, a developmental stage, a marriage, a baby, and then you might need to go to another layer. And that's how I use people to visualize kind of what healing looks like in order to get to the core wounds. So it's a process, it's a journey. It doesn't happen overnight. It seems like as I've worked in this field that there's so many more stress responses that are from social media, things that have happened in our society, that it seems like a lot of things are getting piled up and piled up. So it's really important to know some of the symptoms if you're getting panic attacks, if you're having depressive moods, if you're having sleep issues. Those are the things that you want to seek help and seek. And this is one of the tools, EMDR, IFS, some other tools that are really important with body work that somebody mentioned, body work, is somatic exercises, yoga, meditation. Now there's sound healing that is really coming along with trauma therapy and working through trauma in your body. There's cognitive behavioral therapy. There's neurofeedback, which is not as prevalent as it was back when I was doing it 10, 15 years ago. But that is also a treatment modality for trauma. So I'd like to, and so kind of putting these two together is IFS, or internal family systems, give us the language to use to go into the EMDR technique to process the trauma. So in conclusion, does anybody have any questions? And we can turn on the question things.
We did get one question online.
Okay.
Someone asked, when using eye movement, are the person's eyes open or closed?
Okay. Eye movement using the light bar or your fingers, your eyes are open. If a lot of people prefer, thank you, the pulsators, because you can have your eyes open or closed. And a lot of people prefer eyes closed. And you can also keep your eyes closed if you're doing tapping on this side or this side.
I think for other questions, you can either type them in the chat and we can try and pull them up, or if you just want to unmute and ask, you're welcome to do that as well. See if I can open the chat. I'm gonna have to close the section.
And while you're pulling that up, I had one question.
There it is.
I know when I first started, I definitely had a belief that my memory of my childhood is kind of a black box. So there's so much that I don't remember.
Mhm.
And so I thought I couldn't do EMDR because so much of it is tapping into old memories to kind of pull that thread, right?
Mhm.
So can you talk a little bit about that? Like if you feel like you don't have the memories?
Yes, people that, for example, for you, is I would start with the negative cognitive shifts. And you might come in and you say, I don't have any memories, but I don't feel good about myself. I feel shame. I feel like a bad person. I feel unworthy. So we can start with the negative thought and instead of the memory. So when you have that feeling of not feeling worthy, what comes up for you? And you can do a here and now, when my boss was very critical, and you can start with bilateral stimulation with that. And then that'll allow, if those protector parts that have blocked the memories, they may allow you to go back down deeper and come up. And it's really only about what you feel in the here and now. So it's in order to feel better, you don't have to go back to your childhood. A lot of people say, what if something comes up that I don't want to remember? Your body's only going to remember exactly what it needs to remember.
That's really helpful.
One of the questions is, can the client practice these techniques on their own?
No. Well, some of the tapping, butterfly tapping, and this calm anxiety, and you would not put the image with the emotions with that, like you do in EMDR for the therapeutic part. But there's I've seen a lot on social media on doing this, and there's tapping, there's techniques that you can look up. There's tapping at certain parts of your face that calm you down. So yes, you can do tapping as a way to calm you down.
There's,
Yeah.
It's fascinating.
Okay,
And I've been a patient.
yeah,
I thought it was all smoke and mirrors at first, but it definitely, it truly was.
Yeah.
When you evaluate someone, how do you realize, how do you know that they're a candidate for EMDR, and how many therapy sessions does it take, and how do you judge the efficacy of the therapy?
okay. Good question. I can do first and third. Second is a process. So what is it?
Okay.
Okay, the first question is how do I determine who's a good candidate? Gathering the history when somebody comes in, a lot of times people are seeking, they see that it's on my website, or I get a referral, you do EMDR, and they specifically come in for EMDR. If somebody comes in and they say I have depression, anxiety, and I want to feel better, I would introduce that and explore that as an option for treatment.
So who's not?
Probably good question. Who's not a candidate is somebody who may have delusional, any kind of psychosis. A lot of times people may have depression, but have had psychotic episodes with depression. Those are the kind that you kind of want to rule out, or maybe spend more time with them doing other type of therapies until they're stabilized to do EMDR. Yes, yes. And the third one is, how do you do, the question that you asked, Ted, is the efficacy. How we measure if the person is starting to feel better. When we take the visual, the image with the emotions, we rate the emotions of 0 to 10. Okay, when you see the image and you feel sad and angry, where do you feel it in your body? I feel it in my chest. On a scale of 0 to 10, 10 being the highest, what number comes up for you when you hold that image and you feel that feeling in your body? An 8, they'll say an 8. So then you do the bilateral, and you do it probably about 15, 20 times, and you do sets of usually 10 to 15. And what I mean by that is, when you do the bilateral, the person may stay stuck in that image, or it may go to other images. So then you talk about what they saw or what they experienced. And then at the end, you ask them 0 to 10, and that will let you know if it's gone from an 8 down to a 5. The other measuring of the EMDR effectiveness is the positive cognition. So I am safe, or I am worthy. You measure that and this is always from a 0 to 7. 7 means I am worthy, holding the image of my mother shaming me or criticizing me. And those match. Because when you come in, it usually doesn't match as a 0, 1. When my mother's criticizing me, I feel unworthy, and it's a 1. So as you measure the 0 to 10, you're also measuring the efficacy of the positive thought with the image, and you want that to get up to a 7. So those are the two measuring. Good question.
Sorry.
Oh,
And then continuation or maintenance therapy.
Usually when you get down, the goal is to get down to 0, 1 with the emotions, and 6 or 7 with the positive cognition. The person will determine if they start having the emotions come up where it's affecting their sleep, affecting their relationships, then they will come back in and seek treatment.
Someone wants to know, does forgiveness play a major role in healing from a traumatic event? I don't know if they mean self-forgiveness or forgiveness to others, but maybe go both.
Okay.
Okay.
Yes, forgiveness, and actually when you say that, that's kind of part of the internal family systems. The goal with internal family systems is for them to become friends, the manager, the firefighter, and the exiles, because they're usually fighting against each other. And there's a component of the roles that I hate that part that cuts. I hate that part that drinks too much. I hate that part that is a compulsive spender. Okay, so there's a lot of self-hate and self-anger. So that's the IFS and EMDRs to get into the self-forgiveness and be able to be okay with the different parts, get to know your different parts and be okay with them. Forgiveness of others, it depends
On this, yeah.
on the situation. I don't think you have to in order to heal. I think the most important thing for healing that I look for is what happens on the
That's
inside.
probably what they-
Yeah, and I think you kind of touched on this a little bit. Someone asked, do clients undergo IFS and EMDR together? So it seems like they are very.
They are, but I don't find a lot of people knowing a lot about IFS. Who has heard of IFS?
I have, but I would think I'm more familiar with like parts is what I would think first. I don't know if IFS would ring a bell before parts work yet.
Parts work.
Yeah.
Okay. Parts work. So it is coming now more into the forefront. Actually, in the past couple of years, it is very effective with psychedelic work. So the more people that are getting trained with psychedelic work, because they found in the trainings that during the psychedelic work, that they kind of connect with the parts on the inside during that session. So it goes really well with psychedelic work. A lot of the clinical studies that they were doing for MDMA, Molly, for the FDA approval a couple of years ago, they found that 85% under the psychedelic of Molly, I think it's like an 8 to 10 hour journey, they found that 85% of them did their own parts work. Because in the clinical trials, the therapist could not do CBT because everything had to be stable. So the client did it on their own. There's one study where the client who was a war vet, and he got in touch with that anger side that he had put in a jail because he didn't like that anger side because it was coming out, his PTSD was coming out with his family members. So he learned to be able to be friends with that part, get him out of that jail that he put him in, call him a warrior, and knew that he needed that part when he goes out and fights. And then he connected with a bully. He didn't realize in childhood that he was bullied. So he was able to access those parts, become friends with them, and help the healing process.
With ketamine as well?
Absolutely. I'm certified as a ketamine therapist, and I do parts work with that. It's because with the ketamine is you'll find the protector parts won't allow them to drop in to the medicine because the defense mechanisms or the managers will hold them from dropping in. So we kind of have to get to know those protector parts so they can feel safe and the person can tell the protector parts, it's okay. We can drop in and go to those exiles and those wounds. It's a good question.
Another question that came in is about Hertz 453 and listening. Does it help to regulate your inner core and relax release?
Yeah, what was the first part of that?
Hertz 453, I'm assuming it's like just the
Like the level of sound, maybe.
Oh,
Like
Hertz.
healing listening, yeah.
Yes, and what was after that?
They said Hertz 453. And does that help to regulate your inner core to relax and release trauma?
There's a lot on healing frequencies, and you can look at, in fact, one of the playlists that I do for ketamine has different healing frequencies in it. So you can look that up. I don't know specific numbers.
But do
There's
they do different
numbers.
things?
Yeah.
Oh, interesting.
There's different Hertz numbers. One could be relaxing, one can be self-esteem, feeling confident. So yeah,
Interesting.
there's a lot of different frequencies.
Is virtual EMDR therapy as effective as in person?
Yes. I am more of an in-person, so it would be more effective for me if I am with somebody face to face. But since COVID, the virtual therapy has really mastered that, and it works. It does work virtual.
And is it usually something from your childhood is like the root of how people handle their traumatic experiences as an adult?
That's a good question because what I have found in working with trauma is if a trauma happened in your teenage years or your adult years, you're going to go back to the coping skills that you learned from a previous trauma. So if your defense mechanisms from growing up in a high stress family or had trauma early in your childhood and you learn to compartmentalize, you learn to dissociate, then you have a trauma later in life that might bring you into therapy. You're using those same ways of coping with the current trauma that you had already developed in your childhood.
question. If someone is not able to get in with a therapist right now, are there any books you would recommend to maybe just work with the parts or the IFS?
Okay, the parts work, this is my favorite because it has pictures. And the one that Ted had asked, like the goal of parts work, and there's a picture here that I really like. It's shows the self and how they can all get together. So I highly recommend this book. It's from Colleen West, and I show this a lot to my clients. The original book, Dr. Dick Schwartz, who came up with this theory. This book is called No Bad Parts. So I recommend that as well to learn about IFS or parts work. Yes.
Is there anybody that you have not been able to just achieve success with EMDR?
It's gonna desensitize. Success is between the between the patient and the client, what success would look like. Because what success might look like with one client is I want to be able to get out of bed in the morning. Or it may be for somebody who may be a high functioning with depression, I want to be able to go to work and not resent being at work all day. So success depends on the client, and there's always movement. Okay, there's always movement. And that there's so that's how I would define success, is there's always movement in the healing process.
I think that it could be life-saving, career-saving,
Yes.
relationship-saving,
Absolutely, all areas of life,
And-
whatever,
whatever level you're at.
exactly, yes. That's a good question, because I just started working with ketamine with chronic pain. What happens with chronic pain? Oh, the question is EMDR work well with chronic pain? Chronic pain has the depression and the anxiety as part of it. It could be prior to, could be trauma before the chronic pain. A lot of times functional doctors are saying that a lot of chronic pain and the severity is due to childhood trauma or trauma prior to it. So you want to look at what the emotional part is to the chronic pain. And they found that decreasing depression and anxiety decreases pain in the brain. It does help minimize those symptoms, and which minimizes the chronic pain.
There's one other question, I believe. Someone is currently doing ERP, and should they do EMDR? Like, is one better, EMDR versus ERP?
And
Or
remind
Maybe
me,
do them at the same time, I think.
remind me what ERP?
I don't.
I actually don't know what ERP is. If you want to
As the person.
put in the
Yeah.
chat what ERP stands for. Also Googling.
Mhm.
Exposure and response.
Oh,
Makes sense.
exposure therapy. They've done a lot of that with PTSD with veterans. I am not familiar with that technique. As far as exposing them, it has been studies have shown in the vets and the veterans of war that exposure therapy is really effective.
Says it's highly effective, evidence-based for OCD.
Oh,
Person put in the chat box.
Yep.
Yeah.
yeah, OCD, yep.
You responded at the same time.
So for example, if you're afraid of spiders, exposures is seeing the spider and then using biofeedback and calming techniques. And that helps decrease that fear.
I think in How to Change Your Mind, they used MDMA for OCD.
Oh.
Yeah.
Oh, really? That
Yeah.
book?
Yeah, have you read it? It's so
No, I just got it
love
though.
it.
Yeah, yeah.
So,
It's a black and white. The,
Pollen is the author.
Yeah.
Yeah. How to Change.
Yeah.
It's all about psychedelic drugs for like therapy.
great, great.
Susanna has another question.
Unless there's somebody online with.
If you're gonna try EMDR, can it be used if a person is currently going through something fairly traumatic, like experience trauma right now, presently?
Absolutely. And one of the things that you look at when you gather history is you check in with the patient you set up the treatment plan and you set up the memories and you can check in. Do you want to start with a memory that's a 10 or an experience that's a 10? Or do you want to start with one that only is a 2 or a 3? And so the therapist might think, let's start with the lower level before we start with the intense trauma.
No.
Yeah. Now you
Well, I just wondered, how do you decide, you know, if a patient is coming in, are you seeing new patients? Do you have openings for new patients? Okay, I know somebody is going to be asking. this. Do you have a
As I
wait list?
said-
Do you have a wait list that
Yes,
can be put on?
yes.
Okay.
Do you take most entrances?
I take the 3 primary, which is TRICARE, Blue Cross Blue Shield, and Centera/Optima.
How, when a patient comes in, how do you, or is it just based on that conversation, like which to recommend ketamine or the EMDR or the, you know,
IFS.
you could,
The ketamine is fairly new in this area. And ketamine, deciding on that, and the way they describe ketamine versus EMDR, it's like EMDR on steroids using ketamine. But ketamine is a process that is usually 2 to 3 hour sessions. So the person has to have time commitment, and there's insurance with some of the 2 to 3 hours, and there's also self-pay. So it might be a financial thing and a time thing. So whereas EMDR can be done in a 1 hour session.
Do most,
That, you know, the ketamine indications, you know, postpartum, PTSD. So the acute indications, you know, you're giving ketamine for postpartum, you have to give it in the first 72 hours, postpartum depression. EMDR effective in that same time period.
Absolutely. Absolutely.
do most therapists do MDR, or is it kind of unique?
It's, if I would look, if people are interested, psychologytoday.com and EMDR certified. Because there's 2 levels, there's EMDR 1 training, EMDR 2 training, and then supervision in order to get certified through the International EMDR Association.
One thing that I've experienced, I know a lot of times when you leave therapy, it can be almost like a emotion hangover, but I think it was way more intense with EMDR. Can you talk a little bit about like how to do self-care when you leave that appointment and just making sure that you're not taking yourself home to then kind of.
Right,
yourself
those
into
wounds aren't
trauma?
just like wide
Yeah.
open. That's a great question. At the end of the session with EMDR is you do a calming, a meditation. One of the things that is, what I was just talking to Ted about, is slow and low. So we would do a short, slow bilateral with the positive image or a safe place. So that that brings you back down, and then you check in with the client to see where their level of, where they are emotionally before they leave, or talk about, there's so many apps for Insight Timer, Calm, to help that anxiety if you still feel elevated or dysregulated.
I'm gonna check the chat for last questions. Did I miss any of your questions? Let me know. Is there any way we can send the slides?
Yes. I
Okay,
was
great.
just gonna say that. Would it be all right if we post your, the recording onto our website?
Absolutely.
And is it okay? We send the slides
To the registry.
So registers, yeah, absolutely.
Well, I can give it up for Tracy. Thank you for sharing with us. This is
Thank you.
awesome.
I enjoyed it.
Incredible.
Thank you. Thank you.
Well, we'll probably log off. Okay.
Yeah.
All right.
Yes.
Thank you, everyone. Thank you for
For
joining.
For your patience as we got started.
Yes, yes.
Bye, guys. Stop sharing.
Great job, Tracy.
Thank you.
Wait, I have a question,
Oh,
Tracy. Thank you so much. I have quick question. This is Joy. Are we gonna are you guys gonna send us evaluations and stuff after this session?
Let me check with Suzanne. Suzanne.
Oh, no, but I love that you said that, and we will institute that. for all patient-
Perfect.
Yes,
It's Joy.
And if you do
Good.
have specific things, you could probably just drop them in an email, but
No.
be nice to us about the technological difficulties. That was.
Oh, no,
working as
it's
a
okay.
team
Look,
to figure that
I
out.
told you it's been that kind of day today. It's all good. I appreciate it. I'm just glad I was able to come and just and attend, and I've learned a lot, and you just like put a lot of confirmation to some things that I had questions to, which is great. So I appreciate you taking the time tonight. Thank you.
Thank you,
so much,
Joy.
Joy. Thank you for joining us.
Yeah, thanks for your questions. It was awesome.
Thank you. Thank you.
Oh, someone asked if you take Medicare, but it sounded like.
I don't
The
take
three.
Medicare. I
Yeah.
do Medicaid through Optima or
Oh, okay.
Synthera and Medicaid through Anthem or Blue Cross Blue Shield.
Okay, so if they have Medicaid Anthem type or Optima, then you can,
But not Medicare.
And
but not Medicare.
And that is one of the things on psychology today. So you can sort by what their
Mhm.
focus is on their certifications, but also what insurance they take. So if that's something
Yes.
you're looking for.
Yep, you can filter that out.
Yeah.
Love Psychology Today. You
Oh,
can
it's
see the
all of it.
pictures, the bio,
Yeah.
what insurances they take
I'm in a
and what
long
type of
term
treatment you want.
Well,
6
I am
years.
too, but she moved to Spain, so we're doing virtual from Spain.
That's worth it. Okay.
All right, thank you, everybody.
Thank you,
Bye-bye.
everyone.
What percentage of this, how much of your, what percentage of your practice is EMD?